It's not a trend. It's not a miracle. Apple cider vinegar has real biological mechanisms that explain why it works for high blood pressure, blood sugar, and body fat. Science has already mapped this out. The problem is that alongside the right information, a lot of wrong guidance circulates. And some of that wrong guidance is genuinely dangerous. Before the end of this video, you will know exactly what works, what doesn't, and what may be harming you without you even realizing it. I'm Thomas Ellsworth, and metabolic health is what I have studied and closely followed for years. If you're not yet subscribed to Senior Health, subscribe now. There's serious content here, no fluff, no empty promises. Let's start with the basics, because the basics matter. Apple cider vinegar is produced through the double fermentation of apples. First, it becomes alcohol, then specific bacteria transform that alcohol into acetic acid. It is that acid that concentrates most of the product's therapeutic effects. There's no secret, no magic formula. It's chemistry, it's biology, it's controlled fermentation. But here begins the first point that most people completely overlook. Not all apple cider vinegar is the same. What you find at the regular supermarket, clear, transparent on the shelf, may be completely useless in terms of health. Industrial processing filters, pasteurizes, and removes exactly what makes the product therapeutically effective. And you may be using it every day, thinking you're taking care of yourself, when in reality, you're just dressing a salad. The vinegar that works is organic, unfiltered, unpasteurized. It needs to be cloudy. It needs to have a visible residue at the bottom of the bottle. That residue has a name. It's called the mother of vinegar. That's where the enzymes, beneficial bacteria, and bioactive compounds that make a real difference in the body are concentrated. The ideal acidity is between 4% and 6%. That needs to be on the label. If the bottle is clear, the liquid transparent, and the price very low, pass on it. That's not the product that will help you. Have you ever used apple cider vinegar? Is it part of your routine today? Comment below, because that will help me understand what you already know and what still needs to be clarified. Now let's talk about what this product does inside your body. And where do I start? With blood pressure, because that's where the data is most compelling and most overlooked at the same time. The modern diet has created a silent imbalance between two essential minerals, sodium and potassium. Today, the average consumption ratio is around 5 parts sodium to 1 part potassium. The ideal would be 1 to 1. This is not an opinion. It is documented in studies that tracked changes in dietary patterns since the 1960s, comparing what our ancestors consumed with what is on most people's plates today. And that imbalance is directly linked to the global rise in blood pressure. Apple cider vinegar is naturally rich in potassium. When consumed regularly and correctly, it helps rebalance that ratio inside the body. Potassium acts as a natural antagonist to sodium. It helps blood vessels relax, reduces peripheral vascular resistance, and promotes the excretion of excess sodium through the kidneys. The practical result is more controlled blood pressure over time, not overnight, but consistently, progressively, and measurably. And it doesn't stop there. The acetic acid in vinegar also inhibits an enzyme called renin, which is directly involved in the process of blood vessel constriction. When that enzyme is modulated, blood pressure tends to drop in a smoother and more sustained way. This has been observed in clinical studies. It's not speculation, but here comes a point that will come up several times in this video because it is the most important of all. The dose and the method of use make all the difference between medicine and poison. And there is a specific timing that many people use based on wrong advice from social media that can seriously damage your mucous membranes. I'll get to that point. But first, I need to show you what happens when vinegar meets fat metabolism and blood sugar. Let's talk about weight, because that is probably the reason most people come across apple cider vinegar in the first place. And the good news is that here too, science has something concrete to say. Research conducted over 45 days monitored groups of people using apple cider vinegar regularly. The group that made no changes to their physical activity lost an average of between 2 and 3 pounds over the period. The group that combined vinegar use with physical exercise lost between 6 and 8 pounds. These numbers are not an influencer's promise. They are data from controlled studies. But how does this happen inside the body? Acetic acid works on 2 main fronts when it comes to fat. The first is leptin. Leptin is the satiety hormone. It is produced by adipocytes, the fat cells, and sends a message to your brain saying you've eaten enough. The problem is that in people with excess weight, that signaling is often compromised. Apple cider vinegar helps sensitize leptin receptors, making that communication more efficient. The practical result is that you start feeling full with less food, more quickly, and for longer. The second front is fat metabolism itself. Acetic acid inhibits enzymes responsible for fat accumulation in the liver and tissues. It also stimulates the oxidation of fatty acids, meaning it promotes the process by which the body uses stored fat as an energy source. This doesn't eliminate the need for a balanced diet, but it amplifies the process when the other conditions are in place. Now we reach the point that may be the most impactful in this entire video: blood sugar control. Glycemic control studies show that correct use of apple cider vinegar can reduce blood sugar levels by up to 40%. That number is real. It's published, and the mechanism behind it has a name: insulin resistance. Think of it this way. Insulin works like a key, and every cell in your body has a lock. When you eat, sugar enters the bloodstream, and insulin goes to each cell, puts the key in the lock, and opens the door so the sugar can enter and be used as energy. That's the normal process. The problem is that over time, especially in people with diets high in refined carbohydrates and sugar, those locks start to rust. The key goes in, but the door doesn't open as easily. The pancreas then produces more insulin to force the entry. And that cycle, repeated for years, leads to prediabetes and eventually type 2 diabetes. Acetic acid acts directly on that lock. It increases the sensitivity of cells to insulin, making it easier to open the door. Sugar enters, gets metabolized, and blood levels drop. This has been documented both in fasting and after meals. And it is especially relevant for those who already have a diagnosis of prediabetes or controlled type 2 diabetes. But here I need to pause and be very direct with you. Apple cider vinegar is a supportive tool. It does not replace medication. It does not replace medical supervision. If you have diabetes and use insulin or any oral hypoglycemic agent, the use of vinegar needs to be discussed with your doctor before you start, because the combination can lower blood sugar beyond what is safe. And severe hypoglycemia is a medical emergency. There is also another process that very few people associate with apple cider vinegar, and it deserves attention. It's called glycation. It is what happens when excess sugar in the blood starts binding to the body's proteins in an uncontrolled way. This process damages blood vessels, accelerates skin aging, compromises kidney function, and contributes to the clogging of arteries, atherosclerosis. By helping keep blood sugar more stable, apple cider vinegar indirectly slows down that process of degradation. It doesn't stop it, but it slows it down. And here I need to clear something up once and for all because it circulates widely on social media and is completely wrong. Apple cider vinegar does not treat intestinal parasites. It does not eliminate worms. If someone told you that, forget it. There's no scientific basis whatsoever. For parasitic infections, there is proper medical treatment. There are no shortcuts. The most common mistake I see circulating on social media is simple and direct, drinking pure apple cider vinegar on an empty stomach right after waking up. It seems harmless. It even seems healthy, but it isn't. Acetic acid in pure concentration without dilution irritates the mucous membranes of the esophagus and stomach. On an empty stomach, that irritation is even greater. Over time, repeated use in this way can cause chronic esophageal inflammation, gastritis, and even erosion of tooth enamel. Acid corrodes. That is a fact. And the fact that it is natural does not make it harmless when used incorrectly. The rule is simple and has no exceptions. Never drink vinegar straight. Always dilute it. The initial dose recommended by studies is 1 tablespoon of vinegar in 150 milliliters of water once a day. That is the starting point. Over time, if the body tolerates it well and there is no digestive discomfort, it is possible to move up to 2 tablespoons in 200 milliliters of water up to twice a day. But that is the ceiling. More than that brings no additional benefit, only additional risk. And the timing, here's another point that causes a lot of confusion. The timing most supported by studies is 1 hour before main meals. This maximizes the effect on postprandial blood sugar, the spike in blood sugar that happens after eating. By consuming the vinegar before the meal, you prepare the metabolic environment to receive food in a more controlled way. In practice, the times that make the most sense are around 11 in the morning, 1 hour before lunch, or around 5 in the afternoon. These times respect the natural rhythm of metabolism and reduce the risk of gastric discomfort. What you should avoid is first thing in the morning, right after waking up on a completely empty stomach. That is the dangerous timing. And it is exactly the timing that shows up most often as wrong advice online. After drinking, wait a few minutes before brushing your teeth. The acid temporarily softens the enamel. Brushing immediately can cause wear. Rinsing your mouth with water before brushing already solves that problem. Now let's talk about who should not use it, because there is a group of people for whom apple cider vinegar represents a real risk, and that information needs to be clear. People with chronic kidney disease should not use it without medical guidance. Kidneys that are already compromised have difficulty processing excess potassium, and vinegar rich in that mineral can worsen the condition. Hyperkalemia, excess potassium in the blood, is a serious and potentially fatal condition in kidney patients. People with a history of gastric ulcer, erosive gastritis, or severe gastroesophageal reflux also need to be cautious. The acidic environment is already compromised. Adding more acid, even diluted, can worsen symptoms and delay healing of the mucous membrane. People who use diuretics, laxatives, or diabetes medications need to speak with their doctor before starting. The interactions can alter potassium and blood sugar levels in ways that need to be monitored. And children should not use it. Simple as that. For everyone else, when the right product is used at the right dose at the right time, the benefits are real and documented. More controlled blood pressure, more stable blood sugar, more efficient fat metabolism, more consistent satiety. It's not a miracle. It's physiology. It's the body responding to the right stimulus. Remember what I said about the right product? It's worth repeating because it is fundamental. Organic, unfiltered, unpasteurized apple cider vinegar with acidity between 4% and 6%, cloudy with residue at the bottom. That is what you should look for. Read the label. If that information isn't there, it's not the right product. Consistency is what turns any habit into results. There is no heroic single dose that replaces regular use over time. 2 months of consistent use with a minimally adjusted diet is already enough to notice a measurable difference in blood sugar and blood pressure readings. Health is not built with a dramatic gesture. It is built with small choices repeated every day. Do you already use apple cider vinegar in your routine? And if you do, were you using it the right way? Tell me in the comments. I want to hear your real experience with this. If this content made sense to you, leave a like, share it with someone who needs this information, subscribe to the channel, and turn on the bell. That helps Senior Health keep delivering serious content about health.